Liz Bottrell, physical therapist and owner at Artisan Physical Therapy in sunny Los Angeles, California. Thanks for joining today. What I'd like to talk about is a hot topic in physical fitness, and that is IT Band Tightness or IT Band Syndrome. So if you're a runner, biker, somebody that uses your legs a lot, such as somebody that's doing a lot of weights, or if you're participating in CrossFit, guess what? You need to know about the IT band and some ways to prevent it from getting too tight. In the first video in this series, we spent time talking about what is the IT band, what is the TFL, why do they get tight, and how that's due to a lot of imbalances. Today we're going to spend time talking through some stretching and then some strengthening exercises that can help prevent IT band tightness from occurring, or if you do have it, from how to minimize it. So if we want to stretch out the IT band, we can do a stretch in standing. So what you want to do is you're going to, say we're going to stretch out the right side. So we want to increase the distance here in order to stretch that band as it goes down the leg. So what we'll do is we'll stand your upper arm width away from the wall. So you'll put that on the wall, just like so, just resting comfortably. You'll point your right toe out towards the wall, maybe about 20-30 degrees. And then what you're going to do is you're going to cross your left leg over your right leg. You're going to put your hand on your hip, and you're going to bring your body in then towards the wall. You do this sort of side bend in towards the wall. And what that's going to do is it's going to create increased distance over here, and you're going to be able to stretch the IT band. Usually when you're trying to improve muscle length, you want to hold that stretch for longer periods of time, so we're talking more like 30 seconds. So one of the things that is popular and that I'm also an advocate for is using a foam roller for your IT band. It's a really dense, fibrous, ligamentous tissue coming off the TFL at your hips. And so sometimes we just need to use our body weight, and that's where the foam roller comes in. I really like a 6-inch, and just when people get a foam roller, I have them get one that's 36 inches long, and that's because you can do things for your back that's helpful for your back, your neck, your shoulder, postural things in general. So but you want it to be just normal density, nothing really fancy. I don't advocate initially getting anything with knobs or really hard density. So these white ones, they're usually like $20-$25 depending where you get them, can be just really great. So what we're going to do is we're just going to roll up and down on the side of the IT band. This is not comfortable at first. I've been doing it for a while, so I'm going to make it look easy. If there's spots that are painful, you can either avoid them or go at them, depending whether it feels like a good hurt or a bad hurt. And that's something that you want to be able to identify just in general, is knowing the difference between those. So I'm just going to come down on my side, and I'm going to use the foam roll. I'm just going to go up and down here. You can go all the way to just above my knee where the IT band goes in and crosses my knee, and I can come all the way up towards the greater trochanter, but I don't want to run over that because that can irritate the bursa there. I can just go up and down, and I'm feeling for spots that feel tight or painful. Particularly, I really like to get down lower to the knee where it's a little bit tight, but the whole area is great. Okay, so you're just going to go up and down. This knee is bent, helping support the body, and it's this leg as well as this arm that are helping you move up and down. As it gets easier, you can use all your body weight, your lower leg body weight, and just roll up and down like this. Like I said, I'm making this look easy because I've been doing it for a while, and I use even a denser one now for that reason. I even get a little bit more aggressive, so if you're finding it's not helping anymore, and for my running and cycling, because you're bending and straightening so many times that can get tight, I'll bend my knee. So I'm bending my bottom knee to tighten that a little bit more, and rolling up and down on that. Or I'll even go in and out as I roll up and down. I'll straighten and bend that bottom leg just to really give an excellent stretch to the IT band. So that's how you can use the foam roller. So we talked about standing stretches, we talked about how to use the foam roller to stretch. Now we're going to talk about some strengthening. So let's talk about an exercise to strengthen the deep hip flexors, or the iliopsoas. What you want to do is make sure those are nice and strong so they're taking stress and doing their part, not putting the stress on the TFL and the IT band. So if you lay on your back with your feet straight, so have them pointing up. As you do this exercise, you want to make sure that your pelvis doesn't rotate So you're going to use your abdominal muscles in order to do that. Let's continue with the right leg. So if I'm just going to turn my hip out about 15 degrees, not real far, so just 15 degrees like so. And then I'm just going to lift it up about a foot and down, and I can repeat that 10 times, do 3 sets of 10, and that's a pretty basic amount that's typical for the average person. So as we continue to work on addressing the muscle imbalances here, we want to strengthen the gluteus medius, which is here on the side of the hip. And so we can do that with a clam exercise. This is a very common exercise, very often done incorrectly, but very common. So what we want to do is lie on your side. Just rest down, keep everything vertical, everything stacked on top of each other, knees on knees, heel on heel. As you do this, you're going to want to not push through your toes, but from your heels. And you want to keep your hips relatively straight. That's my preference with my clients. I don't like them to be really bent. I think it's more beneficial to target if you're more straight. So we'll start with you straight. You want to use your abdominal muscles to prevent your pelvis from rotating as you lift up. So just give that a little squeeze. You can keep your hand on your side to monitor how you're doing. And again, pressure just through the heel, not through the toes. And then you're going to lift up that top knee. So you're opening your legs like a clam. So we call these clam exercises. You're doing it right if you can feel it tightening back towards your buttock. So if you find your greater trochanter here, which is your hip, you're going to feel it towards the back side there. This is one that you're going to need to do quite a few repetitions. It shouldn't be to infinity, but you're going to need to do a lot more than 3 sets of 10 in order to fatigue it, because we use this muscle all the time for walking. So, try 25, 30, 50 at a time. If you're doing more than that and really not getting fatigued, then make sure you're not just cheating, okay? That's clams. The next exercise I'd recommend is donkey kicks. And this has to do, again, with working on your hip abductors a little bit further back here. Now, we're going to get some glute max in with these. And so what you'll do for this exercise is you'll just go on your hands and knees. Okay, so hands are going to be right under your shoulders. Your knees should be right under your hip. And what you're going to do is you're going to bring your leg back. We're going to do a combination of donkey kicks and fire hydrant. So leg comes back, and then fire hydrant's kind of like that dog coming up, greeting the fire hydrant, doing his business. And you go up and back like that. I would start out 3 sets of 10 as that as well. So squats are all exercises that we're fairly familiar with, but don't always do regularly and don't always do properly. But this is an exercise that we can really work on the back side of our hips to make things stronger. So a good squat is just coming down as if you're going to go in a chair. So you bring your hips back, your knees don't go past your toes. Okay, so it looks like this. Again, coming back like so. Good, not this. So we don't want to squat like this, squat and back like that. So we really can accentuate this now. So in particular, to help us with this IT band tightness, is if we bring this band just right above the knee, okay? And you're going to do that clam kind of motion, but now as you're standing up. So it looks like this. Two, 3 sets of 10 is a great amount. You can do holds, all sorts of things to really work on those hip abductor muscles. I'll show you windmills next. Windmills, you'll stand on one leg, and then you're just going to bend forward and back. So as your trunk goes forward, your other leg goes backwards. So if you think if you're looking, to me, you're looking, I'm the side of the windmill. So one arm goes in, the other goes up. So 2 sets of 10, 3 sets of 10. Some people call this exercise RDLs, or Romanian deadlifts. You're just going to go like that. This concludes the second video in the 2-part series about IT band tightness. I hope these exercises are helpful for you. If you have further questions or continue to have problems, follow up with your local physical therapist. In SoCal, in Los Angeles, you can look us up at artisanphysicaltherapy.com. You can also, just for further information, subscribe to this channel, like us on Facebook, or subscribe to the blog. Remember, let's together get to the source and together get moving.